Welcome everyone again to the Places to Grow collective learning event. I think this is the 9th event that we are organizing, if I'm not mistaken. Yeah. Places to Grow is a catalyst for excellence in early childhood development. We are active in the Central Eastern European region, more precisely in Czech Republic, Slovakia, and Hungary. And this program is operating thanks to our partners who are active in these three countries, pushing the early childhood development agenda forward and working on systemic change, which also involves policy changes. And as such, I think it's important to recognize the importance of collaboration with different institutions. And today we will talk about very important institutions in early childhood development, namely municipalities. Municipalities have a lot of power to change the policies around early childhood development, to change the practice around early childhood development. So I'm very happy to introduce to you our today's speaking, who is not other but Yiğit Aksakoğlu. And Yiğit will, of his experience as early childhood development policy practitioner, and especially talk about some of the projects that he was part of that was involving municipalities and how the collaboration with municipalities went and what he learned from these collaborations. So we will hear a short presentation from Yiğit, and after the presentation, we will open the floor for questions or comments. So basically, it's going to be a more open conversation where you can also share your stories. But now I would like to give the floor to Yiğit. Yiğit, the floor is yours. Thank you very much for accepting this invitation and sharing your experience.
Thank you, Maxim. Hi, everyone. It's a pleasure to be among you. Thank you again to Places to Grow to give this chance to talk to you and meet you, although online. I am originally from Turkey. Was in Istanbul lastly, and I'm resettled here in the Netherlands for the last 5 years. I'm now based in The Hague, and unfortunately not doing anything related to early childhood. I'm a program manager at an NGO working on human rights at this moment. This is more or less me, but I'm curious to hear or see who is in the room. So instead of going one by one, can we do a hand raise, like who is from, say, academia in the room? Any academics, anyone from universities, for example? No one? Okay, so we can talk badly about them since there's no one. All right. Anyone from municipalities then? Yes. Hi, Martina. No one else? Okay. I'll keep an eye on that. Anyone from NGOs? I think most of us. Yes. Yes, yes, yes, yes. Okay, we are an NGO crowd. Good. And anyone from companies like corporate world? No? Okay, that's all. Oh, okay, Karin is from, yeah, all right. Karin is from the corporate world. All right, good to hear. So we're mostly NGO folks doing more or less the same things and so on. I'll try to use my time efficiently, but it is not my best hand. So now let's first see whether you see my screen good enough, as in the case of all presentations. Just a second. Can you see it? Like one page.
Yes.
Oh, good. Okay. I will try to share with you what we did back in Turkey between 2016 and 20, where I was the country representative for Turkey for Bernard Van Leer Foundation. It is now, I guess, called Van Leer Foundation, and it is a grant-making organization focusing on early childhood, mainly 0 to 6, but in our days, we were focusing on 0 to 3. I should also say that, yeah, with the program we used, sorry, the global program of the foundation by then was called Urban 95. We adapted it, localized it, and called it Istanbul 95 to work on the Istanbul scale. And then each municipality we worked with took over the ownership and called it with their own name. So Beyoğlu 95, Sultanbeyli 95, and so on and so forth. I should also mention the context political context that we worked in between 2016 and 20. During 2016, there was a crisis between the Netherlands and Turkey, so the international relations were not so good. In 2015, we had a coup attempt in Turkey. Therefore, the country was governed under emergency law. And therefore, there was a very polarized political scene, I must say. And then we based our strategy on that. Additionally, most of the services like education, health, and so on are provided centrally in Turkey. So the ministries have local service provision mechanisms, and everything is administered centrally. However, it starts, or for education, it starts from the preschooling. So preschools are managed by the Ministry of Education, but anything before the preschool, so before 4 or so years old, there was not much of regulation at that moment, and now this is an ongoing discussion back in Turkey. So, considering the political atmosphere, that we as a foreign agent cannot collaborate with the government, therefore the ministry, we decided to approach the municipalities where they had certain service provision, infrastructure, and sometimes certain services related to early childhood, but not directly, not intentionally, and so on. Uh, so yes, I will talk about three things that we learned. This is my daughter 6 years ago. That was her laser focus superhero costume. So the lessons we learned during this time is that first it takes a village. So in our terms, it takes everyone who could contribute to the early childhood development should and can contribute. So we need to cultivate partnerships, leave no one behind. So from the mayors to the frontline workers, we needed to engage everyone and then keep the attention on the intention, which was for us scaling up. We were not interested in the impact in the RCTs or 50 kids there, 100 women there, and so on. We were interested in how we can scale up with the organizations, with the know-how we had, and with the service mechanisms we had. So we did not engage the municipalities first. So we went to reach to different partners. Mostly we call them knowledge partners, like universities, like think tanks, and companies who are experienced in their areas. The Urban 95 strategy had three program areas. One was parent support, another one was evidence-based decision-making tools, and the third one was child-friendly or early childhood and caregiver-friendly public spaces. So before we went to the municipalities, we found or we recruited partners from these three different areas. On the picture, you have two rectors, one chair of the board of a think tank, and our former program manager and so on. So we reached out to a public university to develop a home visiting program, which we designed as our parent support component. We identified Reach Up and Learn from Jamaica, from the West Indies University. It's a well-known evidence-based intervention. So the local team received the training from the West Indies University on how to provide home visiting services. But then the university academics, they adapted it to the local needs and what they know from the country. We approached a think tank called TESE, Turkish Economic and Social Studies Foundation, and Kadir Has University to develop maps that I will talk in detail in a minute on where the most disadvantaged kids are in the cities, in the districts or metropolitan municipalities where we were working, and how many are there. Because we may identify the most needy neighborhoods through different indicators, but we don't usually know how many are there. And then we worked with an architecture company to develop some guidelines and some piloting on how we can design or improve design of public spaces starting from playgrounds. So only then we reached out to municipalities. Uh, uh, why this has worked? Because this has first increased our credibility when we approach the municipalities, and then this enabled all partners to own the ongoing process. We contacted more or less 15 different district municipalities in Istanbul, and eventually only 4 of them agreed to collaborate with us. They refused us for different reasons, like saying they already have such services, or they were not very much, they did not very much trust that we didn't have any other agenda than provide or improve services to early childhood. So we offered to municipalities, first of all, these maps. So when we met them, or before meeting any municipality, we studied their activity reports, their budgets, and their strategic plans. Especially budgets gave us quite a high chance to argue that they are investing to anything but early childhood. And in the worst case scenario, we checked the number of people dying in Istanbul and the budget of funeral services, and then compared the number of babies born in Istanbul and compared it to the budget for allocated for early childhood services. So we came to a conclusion to say to almost all mayors that your district, your city is a great one to die for because you have all kinds of services, but unfortunately, you have no service for those who are born, and the numbers were quite clear. There were like 1.2 million children in 0 to 4 age group only in Istanbul, and there were, I think, about 600 babies born on a daily basis only in Istanbul. So we studied well what they had already, what their budgets are, what services they have, so that we can talk about which service we can embed the new services and so on. Going back to the map, this is combination of two different data sets. First is the neighborhood age group data taken from the Central Statistics Institute, which you can see. I just clicked one of the neighborhoods here, and then it tells you the number of people in certain age groups. Then we combined it with the data coming from municipalities, where they have to publish neighborhood-based square meter prices, which is a proxy indicator for income. Unfortunately, the State Institute for Statistics do not collect the data on income. Therefore, we needed a proxy one, and we used the property prices. So the map shows where you have the highest number of kids compared to the property prices. The dark blues are showing the highest numbers and lowest square meter prices, and the dark red or Bordeaux shows the lowest numbers with highest property prices. So you can easily see that the center of Istanbul is somewhere around here. I don't know if you can see my pointer too. Okay, good. And then the more you go outside or to the periphery, the more you have kids and the more they are poorer. So anytime we went to any municipality, we had these maps already prepared. Then the think tank, this was developed by Kadir Has University's Istanbul Studies Center. Then the think tank collected data from each district municipality. There are 39 of them only in Istanbul. From each district municipality, different services. So this map, for example, it's an interactive one. I can share the link after the presentation. Then you can play with it yourself. This one combines the square meter, age group numbers, and so on with the location of the parks. So here the yellow dots are showing the district municipality parks, and the red dots are showing the metropolitan municipality parks. At this level, we cannot see where the needs are, other than the ones are obvious. But when you get down to the district level, which we did the same thing for each district, then you get to see which or in which neighborhood kids don't have access or easy access to parks. So when we went to the Beyoğlu municipality, Beyoğlu municipality's Parks and Gardens department, the head was surprised to see this map because for him it's only a list of parks. So all those yellow parks for him is something to repair, something to fix, and so on. But he never had an eye on where the parks are and who has access to those parks. So this has enabled us to communicate with the responsible people. But before that, collection of the data from municipalities enable the municipalities to talk among themselves, among different departments on what they have. Some of the services unintentionally were reaching young children, for example, through their mothers or caregivers and so on. And some of the services like parks and gardens never thought of young children and their caregivers. So while collecting the data, we also contributed to initiate a type of communication among different departments within the municipality. So let me check my notes. Yeah. So we use the map not only for parks, I went through the parks, but also when we suggested the municipalities to provide home visiting services, the same maps were also a good start for us where to start recruiting mothers. So we targeted the same neighborhoods to recruit expecting mothers for the home visiting program. Yeah. All right. So the second thing we learned was that getting the mayor on board was never enough. So we approached from different levels of the municipal bureaucracy to start partnering with them. It was sometimes the mayor, sometimes deputy mayor, or persons responsible for like parks and gardens and so on. But we understood that we had to convince everyone from the mayor to the frontline worker that this can be done, this is achievable, and they could have a contribution to it. So the parks and gardens, I'm too much focused on that because that's where we get the most change. Yeah? The parks and gardens department people usually were very happy to see that they could do something as well. Like if only they cut the trees from that high instead of that, then they could prevent some injuries, for example. No, things like that, simple things, low-hanging fruits, we call them. They were really simple things they could do, so they were happy to contribute. But in order to engage them, we did not only meet, but we had to convince them through different means. So we created those means, either locally or globally as from the headquarters of the foundation. So we organized only for municipal leaders, learning journeys or study visits to the Netherlands, to Denmark, and so on. We allow them to meet their counterparts in different municipalities and how they provide services. It also enabled them to see how easy actually it is to do. The foundation organized an executive education on how to scale up early childhood services in a prominent university. So we enabled some of our partners to attend those executive education opportunities. And we enabled municipalities to gather among themselves, although they were coming from different political parties and they were quite in opposition. We enabled them to learn from each other's experience. And we also observed that they started doing it on their own without our initiation after a while. So this type of institutional leadership enabled us to let them run their own program without much of our intervention and much of contribution from ourselves. Let me check again my notes. Yeah, also for other than municipalities, I must also say we engaged, for example, the rectors from the beginning of the universities we were working with. From the beginning, anytime we met any partner or potential partner, we clearly made our intention or we shared our intention that it was not to give a one-time funding, but we were willing to establish a long-term partnership in which we can influence the institution itself. So that was our idea. We never looked for short-term project outcomes and so on, but we always looked out for a long-term partnership relation, trust-based partnership relation with any organization we came across. And therefore, we included different parts of different companies, NGOs, universities, and so on as well. Okay, let me see. Oh yeah. Okay, I told you those are photos from the home visit. I can tell more if you're interested, and I assume you are as early childhood specialists. I can tell more about the details of how it worked and so on, but I'm just going to mention it as a service at the moment. Our last learning point was to keep the attention on the intention, which was for us scaling up. When you meet very engaged university professors, they are unfortunately only interested, or more or less only, but mostly interested in research. Yeah. But we wanted them to be in the field with the service providers because they could learn from each other a lot. Because the professors were never been into the field of the poorest neighborhoods in the city, and the frontline workers were not in this prominent university or met the professors before and so on. So they had something to learn from each other. The mayors, unfortunately, were not interested at all in the brain development, in the cognitive development, this and that, but they loved to cut ribbons. So we had to give them as well something to appear on the media, to give their speeches and so on and so forth. For the university, we had to make sure that there was a very robust research component, but then again, we made them sure that this is about implementation and not only about research, intervention and research. Numbers were our best friend, I can say. From the beginning, when you meet the mayor or anyone from a district, we were able to say what is the number of kids in need in this neighborhood on a very large scale. You can say in Turkey at least 10% of an overall population is in the 0 to 4 age group. Yeah, so 10%, the most in need of this 0 to 4 makes 1% of the whole population. Yeah. So the numbers are very easy. If you have 600,000 or 500,000 people in a district, you have 50,000 kids in 0 to 4 age group, and 5,000 of them are in immediate need. They are the most needy in this neighborhood. So the numbers were not, we were not, or say the universities, municipalities, and so on, were not used to hear numbers in thousands, let's say, yeah, when we talk about projects. So that's why we pushed everyone the idea that one day these services, those which we are piloting now, should aim to reach those thousands, and we need to find a way to do it, either the money, the staff, or find different ways of reaching these people in need to provide these services. We were not, we were only ready after 2 years of implementation and piloting to scale up with metropolitan municipalities. Before that, I was afraid to have more demand than we could respond to. Yeah. The number of people who could work with municipal leaders were limited, so we had to come up with different solutions. We created feedback loops at every level, starting from the mothers in the field or the users of public spaces or the mayors and so on and so forth, so that we can always learn from the field what's going on and adapt to it. And this is what happened as well. The teams developed different methods or interventions based on what they heard and saw in the field. Just a quick example. They heard a lot that the caregivers, I'm going to say, but mothers in general, were not very much aware of the nutrition, like how to feed their kids. So we worked with a TV chef to work to develop us some low cost but highly nutritious age specific recipes, and then municipalities distributed it freely to the service receiving mothers, but also to others. So we learned a lot, and therefore we had the intention, and therefore we had those feedback loops in the field. Okay, I want like a bit of a chain, I guess, but some final reflections I can have is that we need local adaptation non-stop, but we take our roots, let's say, from the internationally available evidence-based interventions. So therefore, we did not look for reinventing the wheel, but instead find something that works and then quickly adapt it and start implementing it. We focused on trust and long-term trust-based relationships and learning altogether, and not just funding. As soon as we talked about learning instead of outcomes, results, and this and that, I believe most of our partners were relaxed. So everyone was allowed to make mistakes, only if we could learn from them. And we did mistakes, and then hopefully we learned from them. I can also say scaling requires collaboration, obviously, feedback and intentionality. I try to underline that this was our intention, or we made it clear to each potential partner that we are interested in scaling up and nothing else almost. And that we cannot do it on our own, obviously, and that we were interested in mobilizing their resources actually, because us, as even as the grant making, as a grant making organization, our budgets are incomparable to the municipal budgets, even to small departments within those municipal budgets. So we were interested in mobilizing their resources. Let me see. Yes, then what has happened after 2020? I mean, many things, but fortunately, Istanbul municipality, say, shifted from the governing, ruling Erdogan's party to the opposition, and municipal buildings that we could not enter for 5 years invited us, I think 2 weeks after their election, we had a very large meeting with different departments and so on. So this is my colleague receiving a plaquette. I don't know how it's called in English, thanking the foundation and her for our contribution to the work in Istanbul. The mayor is now in jail, and people are in the streets for that matter. And so, therefore, I believe context is the king. It defines. This was one of my major challenges, I must say, to explain to the headquarters what's going on in Turkey and why we take some decisions or to localize strategy in a way and not that another way. Uh, Trust, I believe, made a good part of our strategy. So with everyone and every institution. Uh, Even we may get a bit too obsessed with evaluation, impact, sustainability, and so on. But if you put scaling up as your final aim, as to reach thousands, if not 10,000s, and so on, mostly it comes together with it. I'm aware that there are debates around fidelity and how, from small scale to larger scale and so on. But I don't think it is time right now when you don't have the service scale because it's more about the quality. Or to give an example, we do not talk about how to scale up primary education because it is done. Now we can talk about the quality of the primary education. But when it's not scaled up, then we don't know how many teachers we need, how many classrooms we need, how many kids we can teach, what methods, and so on. Only when all of these things are in place, then maybe we can talk about how to increase the quality when we measure also the quality of the existing services. So just last note, the maps you can see here now. Yeah, in 2020, the foundation decided to stop its activities in Turkey due to political issues, let's say. The Turkish Economic and Social Studies Foundation continued to develop the maps. Now they also have the gender-based maps based on neighborhoods, income, and so on, and gender-related organizations. They are collaborating with municipalities and gender-related NGOs or women organizations. The Bosphorus University, which is one of the best public universities in the country, established a research center called Baby 95. They are now providing services, support to municipalities without external funding. The municipalities are paying for the services they receive from the university. What else? The Istanbul and also Izmir municipalities, which are metropolitan municipalities, took over almost everything. So they have internal capacity to train home visitors. They developed a place strategy for the whole Istanbul to contribute or to have a larger strategy for the parks and public spaces. İzmir Metropolitan Municipality also developed its own service provision mechanism, has its own internal training mechanism, and yeah, more or less that's what I can say. Very last thing I should say is that we faced many suspicious people, let's say people who were not sure about whether it works what we do, whether it will work or not. But I have not seen anyone who changed their mind after seeing the parents and the change the parents are talking about their kids and so on. So I think it's a beautiful area, the early childhood. Yes, we know that it takes 20 years to see the results, maybe, but just to see the eyes of caregivers being taken care is sometimes enough for a municipal leader to be convinced to invest into the field. Thank you very much for listening. I'm really happy to talk about this after 5 years, I must say. So thanks again for the opportunity. I can talk for another hour or more, but I will stop here and I'll be very happy to answer questions or discuss challenges and hear your experience. Yeah?
Wonderful. Thank you very much, Yiğit. I think it was extremely interesting, your approach and the success that you had. As I said before, we are opening up the floor. So if you have any questions to Yiğit about this presentation and his work, or if you want to share your story, your experience working with municipalities, please raise your hand either on the camera, or you can use this little raise hand icon at the bottom of the Zoom application or your website, and then I will call your name and you can ask or share your story. So please do so. This is the time of the awkward silence, but the awkward silence brings up questions in my experience. Oh, yes. Hi, Stano.
Hi. Hello. I would like to ask a question of what is your theory of change in terms of when do the municipalities, cities, whoever is the administration, take over fully? Like, are you thinking of ever being able to fully withdraw and let them do the job, or you think there will always be a need for some presence? And yeah, any comments on that are welcome.
I think the best case scenario is when they take it over fully, no? Again, in the case of primary education, we do not work on advocating for primary education and universal access for all and so on. But we advocate for improving or how to improve numeracy skills, how to improve literacy skills, how to contribute to the cognitive development of the kids at primary school and so on. So it's the same thing. There will always be things to improve in the field. There will always be new findings, especially with the developing neuroscience. We are hearing new things almost on a daily basis. So we will need to be there to accompany them, but they should be the owners of the service provision. Again, as in the case of ministries of education, we do not, I believe, I mean, challenge me if I'm wrong, we do not have the capacity to scale up anything as NGOs. We are, again, excuse my language, but we are ornaments in this sphere. We can only contribute with a nice color, with something, additional to it. But the main owner of such things or such services should be the governments or local governments, if not the central government. Yeah.
Thank you, Yiğit. I don't know, Stanislav, did Yiğit answer your question? Yeah. Okay. Cool. Thanks. Anyone else?
Now let's hope. Sorry, let's just hope municipalities identify with that approach.
That's the thing. It's a challenge.
I'll tell them you said so. I'll tell them.
Yeah, like I said, we contacted 15 only in Istanbul out of 39, and we faced many things. But it doesn't mean that we had to stop. And some of them, even while working, were not fully into it. But then there is also, here's another thing, there is the demand part as well. There was no demand for improved public spaces for children and caregiver. There was no demand for home visitation. So this participatory approach, like let's ask what they need, it would not work in this case. But once you created the demand, then the municipality won't be able to say, hey, now we're stopping this, because they know that their neighbor had this service and their kid is doing great at school. Now this woman who is expecting is also willing to have the same service. So sometimes it's a chicken and egg kind of an issue, but we need to start from somewhere, either by engaging the municipalities, piloting and so on, or by creating some type of demand coming from the field. And we did not ashamed of comparing them as well. Like we went to one municipality from that party and then told the other, well, hey, these guys are starting with I don't know how many people and so on. Why don't you? And so like they are also, the mayors are also in a way in a competition as well, no? So different tactics, I'd say, but I'd say the strategy is to let them have the full ownership because otherwise it won't last long.
Thank you. And we are still accepting questions and comments. And if you could just turn on your camera for this short period of time that we are having at the end of the event, that would be really nice, so we can see each other, feel each other through this quite cold space of online meetings. Veronica, please.
Hello, everyone. Thank you very much for a very interesting presentation. I would like to ask about the initial data analysis you have done. Like, could you say a little bit more about how you went about that? How you decided what data to collect, what stakeholders you engaged in that very initial process?
What do you mean by initial data?
Well, you mentioned that you did some of the analysis before you started approaching the municipalities.
Yeah,
So-
we use publicly available data of the municipalities in this case. Yeah, so we checked their website and read their strategic plans, analyzed their budgets, looked at their activity reports about like how many kids they reached last year and so on and so forth. So this was our initial data, let's say, when we want to meet the municipalities. But then to prepare the maps, the data is collected from, again, the municipal websites, where they have to publish the square meter price per neighborhood, so that when they do sales of property, that they can be used as reference, no? So this was the initial data coming from the municipalities for the maps, and the central statistics data to see the age groups. But then again, if you're asking for the initial or baseline data for the home visiting services, then it contained several indexes, ASQ, also WHO's maternal depression index, and so on. So it was a combination of various indexes where the researchers collected the baseline and then also collected data in different timelines to compare the change happening in the time. Yeah. Was that the question or not?
It was. Thank you very much. But also, I was just wondering, like, who was driving, like, what data to focus on, and what data analysis to do, because it's very, very complex. So, was it the universities that you sort of approach to help you define what data is available and what would be really helpful in convincing the municipalities?
Yeah, for the municipalities, it was the maps. The maps were our idea, but we approached the university to develop them, and the think tank. So we defined together with them what data we should collect. So we collected on top of property price and age group numbers. We collected inventory of services, focusing on children, women, and social services, let's say, mostly. And when you get to the district level, this service inventory is quite scattered, not standardized, and so on, because each district mayor can decide on what service to provide where and to how many people and so on. So this specific data on how to collect it was decided among us, among the partners, let's say, without the municipalities. We included the early childhood specialists to this type of data collection as well, just for service inventory. And for baseline, going back, to measure the impact, then it was developed by the university, the other university where they developed the intervention. but the data is collected by a company so that it doesn't create a conflict of interest and so on. Yeah. And this was there are studies now available where they use this data coming from the beneficiaries, so it is accessible as well. And the other data became the maps. I'm too much of data, but I don't know which data you were asking for. I hope I answered.
No, thank you. Yeah, it answered
Okay.
just to understand the approach you have undertaken. Yeah.
Thank you. And I see Karin, but I also see Maxim, and I think Maxim has a question for data. So first Maxim and then Karin. Thank you. So Yiğit, I wanted to ask you also about data because you mentioned that you use the prices of property as a proxy data set for assessing the need for early childhood development services or improving the neighborhoods, right? I was wondering if you came across any other proxy data sets that could determine this kind of need, that could determine the need for more early childhood development services or better quality early childhood development services that could tell you that, you know, the children who are living there have smaller or worse prospect of development. Thus, we need to pay attention to this territory, because I think this is the tricky part here, like how precisely you can determine this aspect.
Yeah, I mean, first of all, it's the data we had was on neighborhood basis, so it gives thousands of kids mostly in a neighborhood, and the square meter price we used it as an index or proxy indicator of income. So the lowest square meter for us meant the poorest neighborhood compared to included neighborhoods, no? So if it's on the district level, the poorest district within this district, and if it's on the metropolitan level, then the poorest district neighborhood within the whole, among the whole neighborhoods, which is like 980 for Istanbul's scale. I did not come across other proxy indicators to identify, say, poverty or income in Turkey. But during one of those visits, learning visits to Rotterdam, for example, we have unfortunately seen that obesity maps are coming together with poverty maps or income maps. So the poorer the neighborhood, the higher the obesity rates among teenagers, showed, you know, in a way where to start for early childhood services as well. Other than that, there can be non-geographical targeting strategies. In the case of one municipality, they had already a database of people using their social market where they were only given a certain amount on a weekly basis to do free shopping. So they immediately tapped into this database on see and then saw whether there are people expecting children or children in the first 6 months of birth and so on. So different types, but on spatial, geographical, or GIS level, these are the two. Ours and the Rotterdam are the only examples I can mention.
Thank you. Karin, please.
Hi, thank you for very interesting presentation. Maybe I would like to follow up on Stanos' question regarding the way or the possibility of municipalities adapting it. And I would like to ask to what extent were municipalities able to adapt to the fact that you as a foundation or the foundation decided to stop the activities in Istanbul, and obviously the big chunk of the funding was removed?
To be honest, it wasn't a big chunk. let's start from there. Especially for a city like Istanbul, it was nothing. The metropolitan municipality budget is huge, and we were shocked to see, just to give an example, only Parks and Gardens department hires 750 security guards just to keep the parks and gardens safe. So our task, for example, was to convince the head of Parks and Gardens to hire 10 play workers and instead of 10 more security guards, and see how it works and so on. So how did they adapt? We came up with an exit strategy. So we didn't stop immediately, but we came up with a strategy on how they can sustain their services. For each partner, we had by then a long-term relationship. So that's how the institute or the research unit came out of the university. This was our model for them, or that the model we developed together, so that they could sustain the services now on fee-based instead of covered by us. For municipalities where there was interest to develop internal capacity, we worked with the departments, like with the Parks and Gardens department, on how they can develop new public spaces. We provided a training on playground safety, for example. So we found out there are inspectors around the world, and then they provided how to build safe playgrounds to the department. And then we enabled them to have their own trainers, internal trainers, and the full capacity to conduct the program, even if they hire new people. And we somehow made mostly the Istanbul municipality as the center for other municipalities to use as well. And this is how Izmir and other district municipalities started to collaborate with the Istanbul municipality. Again, we were lucky because in 2019, before the local elections, provision of daycare services became a promise, an election promise. So the two candidates competed, like how many more daycare services they will create and so on. As soon as he was elected, the opposition won. We told him that this is great, but we should embed 0 to 3 in the service provision. Or we advocated for opening up the gardens of the to be established daycare centers as public gardens, as public playgrounds, because after 5 they were not in use. So like somehow we were lucky, but somehow we were intentional in from the beginning that we did not want to be there until the end. Yeah, we wanted to be there until they can do it on their own, and I believe that's what we achieved because we were lucky and we were intentional from the beginning.
Thank you.
Okay, thank you very much. I think this is the time we had today for this topic, but feel free to reach out to Yiğit or to us if you have any other questions, or even you would like to learn more about this project or work with Yiğit on such projects. We have 2 more informations to share. One is that the next collective learning event will be held
on the
Teresa?
20th, in 2 weeks at the
Yes.
same time.
And you can find already a link in the chat section for this next event. If you are interested, please register yourself. It's still free of charge. And we would be happy to have you there as well. And another news connected to Urban 95, and the name comes from, the height of the children's perspective. Like, you also need to take into consideration this height when you plan cities, urban planning. There will be an interesting conference in Bratislava, which is called Start with Children, next week. It's 13 and 14 of May, I guess. And the whole conference is all about urban planning for children. So if you are interested in this topic, it is highly recommended to go there. I guess they have still tickets, and I will be there if you want to meet in person. That's all for today. Thank you again for coming, and most of all, Tom, thank you, Yiğit, for sharing your experience. Beautiful presentation. I wish you a wonderful day and hope to see you next time. Take care. Bye-bye.
Thank you.
Bye.
Thank
Bye.
you. Bye.
Bye bye.
Bye bye.